Akilti, Kenentionga. Hello, my name is Reyna Benitez. I am a Nahuatl woman from Fresno, California. I'm a third-year medical student at AT Still University in Arizona, and together we can elevate med. My desire to pursue medicine comes from my personal connections to communities that lack adequate healthcare access. Both my parents are from a little pueblo called Coatepec in Mexico, and really there's no healthcare access there at all. Oftentimes, my grandma has to travel pretty far to be seen for her medical conditions, and it can be difficult for us to get her medications to her as well. So, coming from that type of community, I think it really helped me want to pursue medicine just because I been able to see how these communities are affected when there's no access to any healthcare at all. My parents moved to the US in the 80s, and even though there was more access to healthcare, I did watch my mom struggle navigating the healthcare system here, and having that language barrier was really difficult. As I've been able to work with the community that I'm with right now in Fresno, we have a large migrant farm worker population, and many of the patients that I see are from indigenous communities like my own. And so this continues to fuel my desire to pursue medicine and kind of help build those gaps and create increase access to healthcare, but also represent indigenous communities in the medical field. I want to specialize in family medicine, focusing on rural areas. Working with migrant farm workers outside of Fresno has been some of the best experiences for me. In these small rural areas, people just don't have access to doctors or specialists, and um, there's just a big need for basic health care. And my patients usually go to emergency rooms or urgent cares to get their primary care needs. Um, and I also really think that family medicine is important for continuity of care, being able to see my patients for years really helps with their health histories and personalize the care for my patients. One experience that I've had recently that helped solidify this for me was working at the Central Valley Indian Health Clinic on the North Fork Rancheria, serving the Mono and Chukchansi communities, tribal communities there. They have one family med doctor that's been up there for 20 plus years, and just seeing his impact on the community and the families there solidified my desire to pursue rural family medicine. I think my background and experiences equip me with unique qualities that'll benefit my future patients. Having grown up working in a factory with my mom and my siblings, and having uncles who work seasonally in the fields, I have a better understanding of the lives and challenges that many of my patients have, and this empathy enhances my patient care. I also, because I speak Spanish, I'm able to create I feel, a stronger patient-doctor relationship, removing that language barrier, and it allows for just more effective and direct communication between me and my patients. One of the unique things that I bring is just my cultural understanding, as in coming from an indigenous background. As similar to my patients, I share many cultural perspectives with my community, including our views on topics such as death and mourning, which differ from other communities, and this insight helps me connect and support my patients on a more personal level. I'm currently also working to getting my master's in public health, with which I feel will help me conduct research that's necessary for me to start any initiatives in my community in the future. One of the challenges that's common among minority medical students is our lack of networking opportunities and connections. And so I really feel strongly that ElevateMeD's focus on mentorship is particularly going to help me. And I've had great mentors. I've been really lucky to have some good mentors throughout my journey, and I want to continue having that. I also want to represent my community, my Nahuatl community, and embrace my roots. It's a big part of me, and I think that we need to see more physicians that come from backgrounds like my own. I want to thank all the donors and sponsors of ElevateMeD for making this opportunity possible. Your support is crucial in helping us become the best physicians